Good evening, ladies and gentlemen. Ed Fields here, along with Rogan Smith, who's back from vacation.
Hey.
Kendrick Williams is co-host. Long day. Long day in Hollywood. You know, that's all I can say.
It is a good day. Yeah. It was a great day.
That's good. So let's see what all, can I look at that newspaper? You mind?
You just asking for it on the air?
Yeah.
All the time you're sitting here? Terrific headline in The Guardian.
So as I was saying.
Terrific headline.
Let's see.
What you looking at, the Carnival thing?
I'm looking at all the things since I didn't look at it before.
You didn't look at it before? Carnival back on?
So Carnival is back on. And
that's a damn good headline.
After it was all over. And so they're up and down, you know.
It's schizo. Because someone should have thought from the initial stage, they should have known May would not have been a good time to put this carnival, considering that we had our last election in May. This is ridiculous.
Well, aside from that, I mean,
it was not a good move from the jump to put it in that month.
Well, there's I can say that having been on the Carnival Commission, I know why they put it on that month.
Wasn't a good call.
Well, fine. So the reason they put it on is because of various other carnivals, et cetera, and obviously it worked well when there's no election day. But having said that, what would be the problem of assuming that it's not election day? What's the problem of having carnival prior to election?
I don't know. Having carnival prior to election, maybe people be too wasted to come out to the polls. There's a lot of things that could have happened. Oh, okay. Yeah, don't sleep on that.
So let me ask you a question.
Some people go, like Junkanoo, sometimes people don't even report up to work the next day.
Yeah, suppose it's like the election is the next week. They're too wasted to come in next week. Please, let me say this very clearly. Those type of people, please don't vote. Okay? All right? If it takes you a week or two.
Go ahead.
Yeah. If it takes you a week or two to recuperate from any kind of drinking, please, I'm begging you, I'm imploring you. In fact, I'm going to implore Mr. Hall to be at the place, and if you did not recover from after 2 weeks of drinking, you can't vote. What happened? Oh, okay, the socks.
Oh, yeah.
Okay.
Well, the thing is, if that's the case and they're going to have it a week or two afterwards, then fine. Then they shouldn't have changed the date in the first place. But then they shouldn't have changed the date.
That's the point.
So that tells me that they probably wanted to have it for the same time the carnival is being
the way
scheduled.
The way I look at it is this: the election, the House seemingly is going to be prorogued around April 11th or so.
April 11th.
Okay. So based on I could be wrong on this, based on the rules, I think they have a minimum of 21 days and a maximum of 28 days, right?
I think that's what I've read or what Ace has said as well on the show.
So if you look at the calendar, a minimum of 21 days takes it to what?
Oh, okay.
It is now the 11th of April.
Okay.
You say the 11th of April is the proroguing day.
Mm-hmm.
So a minimum of 21 days takes it to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19,
okay, as
20.
you count on.
So that's what I'm counting on the air. It's a problem with that? Is there a problem with that?
Yes, there's a problem with that.
22, 23,
you should have done it prior to coming on the air, so you prepared.
28. So that would take it to the 8th of May. So that would be the Carnival ends on the 6th, I think. So it'll be 2 days, or it'll be before Carnival. I doubt seriously if they're going to have it on Friday, Saturday, or Sunday. Have they ever had elections on Saturday and Sunday?
No.
Okay, so the two big Carnival days are Saturday and Sunday. But please, I'm imploring people, the people who are too mash up to make it. Now, one of the things I do understand is that they didn't want to conflict with rallies.
Maybe that was the bigger issue in their mind.
Because I think the rallies would impact Carnival.
You know, we make fun of it, but it speaks volumes to what these people are doing and the fact that they're not thinking straight. Because there's so many people, so many stakeholders who are impacted by this, and it seems that they only got flustered and decided to revert to old plans when they saw the severe backlash. Like who when they were sitting around the table didn't anticipate that people would be really angry about this decision? They didn't think about this.
As my good friend
and that
Kirk
people
Smith,
purchased tickets to come here.
as my good friend Kirk Smith used to say back in the day, when they were sitting around the table and they were saying, we're going to go to Iraq to find weapons of mass destruction, did anyone say, well, what if there aren't any? So, that is the question. Who is saying, they've got, listen, here's the deal. The whole point of having the carnival, was to have people come in.
Yes, it's not to be a party for locals.
So if that was the whole point, you got to assume that a few people
are planning vacations
around it. And this is now about 20 days before that. So when you look at how airline travel is done, hotel bookings are done, people finish with that.
They done booked.
Costumes.
They're purchased.
Parties, the whole deal.
Mm-hmm.
So you just, it's just kind of, as my man Mike Tyson would say. Do you know what he would say?
No.
Ludicrous. It's ludicrous. Okay?
Ludicrous.
All right. It's ludicrous.
It's ludicrous.
So, yeah,
it's just too wishy-washy.
Yeah. So
move.
Anyway, it's
never mind.
It's just
Never mind.
Yeah. So you got that going on. Then of course you have the political stuff going on.
Do you read letters to the editor?
Sometimes. I don't read long letters.
There's a really good one in today's paper.
Okay.
I'll just tell you it says it's signed by The Graduate, and it's talking about Edison Key's wishy-washiness. Since I think it's a good segue from the wishy-washiness of Junkanoo Carnival, but you need to read that when you get an opportunity. It's in today's paper.
Yeah, I'm going to be very vocal. It's not much I need to read about Brother Key. Because
it's so eloquently written.
Yeah.
Like I found myself smiling. Whoever you are, you're a fantastic writer. You need to read it though. Nothing surprises you but Brother Key.
I think I know who The Graduate is.
Oh really?
Anyway. But
Man
I'm
or
not
woman?
sure.
Man or woman?
I think it's a guy. But the thing is about Brother Key, right? It's just, I guess you get to a point in life where you go, you know what? I got to worry about me.
He just reached to this point.
But I mean,
Brother Key been there from a long time ago.
Wherever the point was, I'm not saying the point is here. I'm just saying wherever the point is, you got some people. Some people are focused, man. Okay, and it's like, you know what? I got to get mines.
Mine.
Okay, and at the end of the day, this is why people are cynical about politicians in the first place.
Aye.
Because why don't you think I see that? It's like I always tell people, like, if I have on shades, right? I can see you, but you can't see me.
Yeah, that's what they think, right?
Okay? No, I can see you wearing shades.
I used to think that when I was a child.
No, I can see you. Okay? So I don't know why you would think that if you have a constituency that votes 100 to 2 against you, that the party decides to go with the 100 guy, right? Then you go and, ramble, and then your person decides, well, I'm going to now I'm going to use that to throw the whole thing up, okay? And then after they throw the whole thing up, will you say, you know what? I see y'all ain't got no plan, so I go with yellow.
I say the Graduate said he was enamored with Perry Christie 1.0. Then he moved on to Dr. Minnis, right? And then he decided to go back. Yeah. He did all going way back, right? Then he decided to go with Perry Christie 2.0. Like, it was just really funny.
Well, let me explain what the thing is with Brother Key is. And this is why you will never get anywhere. Okay?
Me?
Yeah, you. Let me explain what the problem with you are not that Brother Key is.
It's a Bahamian word.
It's a Bahamian word that we use. And it's really indicative of how we are.
What does it begin with?
Well, it could either be a V or a W, depending on how you want to
pronounce it.
Versatile. You're versatile.
I knew something stupid was coming the minute he said you can either be a V or a W. This is based on Bahamian people pronunciation. So he's versatile.
You're versatile. That's why you're getting over here.
I look at that as wishy-washy, but you look at it as versatile.
No, that's what you looking at us. But that's why you ain't going nowhere. See, the people who've seen it as wishy-washy, or as we call vishy-washy, okay? The people who say that, okay? The people who see that as wishy-washy, they stand still. But the brothers who versatile, They fought you the head.
Yeah, just read
Okay.
that. Read that out. That was funny.
You know what I mean, Kendrick? You must be versatile. Okay? And when you finish saying versatile, you keep your mouth on your tongue. Versatile.
No, keep your tongue on the roof of your mouth. You mean?
Yeah.
Do it?
Versatile. You see what I'm saying? Did you know that versatile was coming when I said that?
No, I was trying to figure out what could be pronounced as a V or a W. Oh, you're so silly.
No, well, it's not silly. It's just the way it is, okay?
So every time I see Brother Key from now on,
Well, you waste the time,
I can
mate.
see you with that face and your tongue on the roof of your mouth.
You full of versatility.
No, that one don't work too much.
Versatility?
No, that don't work
Yes,
too well.
mate.
That sounds too good. But versatile sounds better.
Versatile. And then how they frame it. This is true behavior stuff now. We're not going. We ain't going outside here now. This is true. What they do is they don't just say you're not versatile. They say, see what's wrong with you? Is you ain't versatile. You see? Anyway, we'll move on for that. All right. So I implore you.
That was funny.
I implore you.
What?
Try to up your versatile game, eh?
No problem.
All right.
So now the bids are in to
For
build
what?
Trump's wall. This is hilarious. So let me just read this real quick. One bidder wants to cover President Donald Trump's border wall with solar panels. Another suggests building a wall large enough for a deck that would offer tourists scenic views of the desert. I'm like, okay, they're going a little too deep. But check this out. So the Roman Catholic Archdiocese of Mexico is really upset that a lot of these bidders are coming from where?
Mexico.
Mexico. Said this isn't the kind of project that you would want to put in your portfolio.
I guess that's how Mexico is going to pay for it. You're going to pay them.
You're going to pay them. Unlike a dam or bridge, this is one where the risk of being associated with the political philosophy of the administration can be damaging to current and future business. So you're a Mexican company. Would you be putting in your bid?
You put it in your bid.
You putting in your bid?
I guess so. If you can get some cash buck.
Kendrick, you putting in your bid?
See.
Yeah?
See,
Ah,
another
Kendrick
example.
say yeah, Mom.
Another example.
Kendrick say yeah.
See,
Yeah.
of course. See, another example. You hear someone
say he
telling
wants
you.
to tell.
No, exactly. See, that's what I said. This is another example.
That's why I ain't going
You
nowhere.
ain't going nowhere.
Boy,
See,
you
someone
ain't
offering
lying.
you now a couple $1 billion contract, and you say you ain't doing it. You ain't wasting time
So
at all.
you
Wait, what?
You gonna put that in your portfolio that you built this wall is so controversial?
Let me explain. Have I not ever explained this to you? When I have
I know you're lying.
When I have $1 billion, right? Me and you ain't in the same set. You understand what I'm saying? When you how much the job? What's the bid for? About 10 billion.
Well, they ain't saying this one.
But it's got to be in the billions.
Oh yeah.
Okay.
But no, this article doesn't say.
When I get my
The prototype alone is $200,000 to $500,000.
when I get my $10 billion job and my $10 billion check, do you think I check it for what you say?
So when people protesting and you can't even handle and
You know
boy,
what?
you better stop.
Excuse me. Listen,
better stop.
No. I'm not in that category. When you in the $10 billion category, you know where they have to be protesting? Monaco. That's where I can be. Monaco on my yacht.
They can protest where other companies in the front of your company's headquarters.
Beautiful, as they say.
Beautiful.
What I can
You don't
do
care.
is when I am cons.
Con.
No,
Not con.
cons.
No, con.
No, that's how you see what.
See, that's why I waste the time.
You ain't gonna make it. She ain't gonna make it.
Can.
You know what?
Not con.
I can tell them.
Can.
I can tell the people in
France.
Cannes. Don't even let you in.
Can.
You
France.
when you go to try fly there, you can be on the stop list.
Me?
Yeah, you gotta make it there.
You go into Can,
You know
France.
what? No versatility. We'll be right back. Good evening, ladies and gentlemen. Just want to say our guest is here, right? Our guest this afternoon is going to be Dr. Nelson Clarke, who we love to talk to. It's Mental Health Month, and so we're going to talk about all aspects of that. He's a very interesting person. I tell you, I'm here with Rogan Smith and Mr. Versatile Ken
That's
Williams.
his new name.
Yeah.
Him and Mr. Key.
Speaking of versatile, and see, this is where y'all can't get ahead. Last night, I was watching your man,
Who?
the Trump,
Oh.
and
How
he
you get my
said,
man?
he did say, he used the word versatile, you know.
Oh.
He said that first, about a week before, he had saying, we're not going to do anything with Assad. It's probably best for Assad to be in power. So after yesterday's, I don't even know what word you put
Did
that
you
in. It's
use-
not debacle.
oh,
it's just,
man.
it's demonic. Okay.
That's the perfect word.
Yeah, it's criminally demonic.
Yeah.
Okay.
It's demonic.
That. How do you before we get into the Trump stuff, because he's about humor. This isn't about humor. How do you kill your own people?
Your own people.
How do you see? This is why. You see what I told you earlier about how easy we got it. You have people who, because of power, and maybe Nelson can speak to this in terms of the psyche, because of power, will maim, I've used these words before, right? Imprison, torture, and kill to
Their
remain
own
in power.
And children.
Because the power is so sweet that it
those
think
people,
of the
no,
word.
those people just sick, man.
No,
It
isn't
on another level.
No, they're sick but the point is, you often find sick people rise to power, and because other people aren't paying attention. But when you look at your boy Kim Jong Il, or what his name? Is it Il? He ill, all right. Okay.
Lil Kim.
You ever see the military stuff he has going on with the people in the square? The square is bigger than Nassau.
And he looks like a. Oh, I almost used a word.
He's doing some freaky stuff.
I almost used the word.
He's doing some. I know Nelson would like an opportunity to evaluate him.
Yeah, need to evaluate him with his bad haircut.
But I would ask if Nelson would evaluate him. I'd want him. I'd ask him to get rid of all his client confidentiality. Tell me what's in that brother's mind, man. Tell me what's in his mind.
He's insane.
But you've got him. You got the Idi Amins. You got the all of these people. Who, I mean, imagine
Putin too.
sitting in a boardroom and deciding on the final solution for a race of people. How do you? So this guy Assad now has using and the most insidious methods, chemical weapons. It's like, what are you trying to do?
I mean, it's like such a painful way to die.
It doesn't discriminate. You do wherever you put it, everybody goes, right? But then you have Trump, who now has flipped and said, well, this crossed many lines. He says, but I'm a versatile guy. I'm very versatile. And then he says, I'm proud of my versatility.
I can't even laugh at him. He makes me so sick.
He in another world, brother. I'm going to ask Brother Nelson to give me a little move on him, too. Little
evaluation of what's going on in his
from
mind.
Afar, because I'm sure he fits some prototype. Okay? He's
completely narcissistic.
I don't know if narcissism. I think narcissism or narcissists, I think they scared of him. Okay? I think he is not in. Narcissists probably say, no, I changed my mind. I'm not going to be a narcissist anymore. If I'm.
Have you guys seen the images from?
Yeah.
I mean, usually when these things happen, I try to avoid looking at them. I'll try to read the articles and not look. But it's it puts you on a totally different level when you look at these children and these people who are in the streets and who died from asphyxiation. It's
making
awful,
a decision in a room
awful.
somewhere to do that. You made a decision to do that. You're saying, I'm going to just drop this chemical bomb.
Who cares? And dropped it on the little makeshift clinics and hospitals as well. So even if you try to take someone there,
And, you just wonder why when I don't know. I guess, I saw this thing on North Korea the other day. And this guy said he was in prison for 9 months. No, it wasn't 9 months, 6 years. And he was tortured every day. He said he went in at 165 pounds. He came out 79.
Jesus.
And then they decided, oh, you're not guilty. It's just, yeah.
You'd be grateful for where you're born, right?
Now, let me tell you, the brothers who sign up for that duty, you don't want them on the force.
Yeah. They're on another level.
Okay? They've raised their hand. Yeah, I'll do the torturing.
Reminds me of Schindler's List.
Yeah, no, it's the human dynamic is beyond belief sometimes. I mean, you just drive downtown, and you take a difference between driving downtown, say on a Sunday evening, well, late Sunday evening when there are very few people.
It's so calm.
And you see the calm, and actually you see the beauty. You get a lot of criticism, and it's almost as if the people make it just unpleasant.
I don't know. I see the calm, but sometimes I see the ugliness of it as well.
Yeah.
Because I find that the people add such life to the city. When I drive through, things don't look as pretty anymore.
Yeah,
without
I mean,
people
you don't
there.
have life, but and I agree with you because you want to have life, right? But behaviors. we have. I mean, by the way, I meant to talk about this, and by the way, Henry says to say hi again.
Oh yeah.
And also my good friend Wayne Bethel said to tell everyone hi. Let me tell you something.
man.
I don't know how much more to emphasize this. I feel overwhelmed because I cannot remove it from my thought process.
What is that?
That except for certain areas where people take it on themselves to keep the areas clean, this town is filthy.
Oh, I
It
have
is
a story for you.
overwhelmingly filthy. And it is beyond belief that people will choose to be. See, look, let's move away from government for a second. You live next to X, or X is in front of you, and there's debris in front of you. You don't feel the need to pick that up?
I thought about you strongly. It was today, Thursday. So this must have been Tuesday. I was driving to work and passing on Bahamar Boulevard, I suppose. And I don't know how you know where it comes to, like, where you go into almost, you can see the cemetery. What's that? Is that, what is that?
Flamingo, where the Flamingo is?
Yes.
That's-
Like
yeah,
a
I know
little
what you
before
mean.
that, a little
Like
before
Gladstone
that.
Road intersection there. Yeah.
Yeah, but not all the way there. I'm still seeing
okay,
Bahamar and
okay,
whatnot. And the car in the front of me flings a banana out.
Mm-hmm.
Right?
Biodegradable, that's what he's thinking in his mind.
And that's what he said, because
you
I
saw
started
tonight.
blowing to him, boom, boom. I kept blowing. And so finally, I guess he started talking to his passenger, like, what the hell's going on, you know? So he looks in the back, then he slows down. I said, hey, why did you throw that out of your car? And he said, oh, it's biodegradable. I said, so I should take that and throw it on your porch then. You cannot do that. You cannot come into people's area, or even in this country. You cannot do that.
Well,
It's disgusting behavior.
First of all, a banana peel is the worst example you could use because someone can slip and fall on it. That's number one. Secondly,
You know how long it takes to break down?
Suppose I get a whole truckload of biodegradables and just dump them in your yard and say, listen, I know this look like garbage, but they're really
It can break
biodegradable.
down.
In about, 50 to 60 years,
Years.
this will be sterile.
And let me tell you something. I know some people who
But
have a
that's
problem.
irrational.
It made
of
me so
nastiness.
sick. And I know people who get mad because you throw things in their garbage. Like, let's say you're driving and you have some trash and you want to put it in their garbage. Or people get really upset. So imagine just throwing it on the side of the road or, close to somebody's house. It's disgusting behavior.
Why is it, though? See, think about this in terms of just basic rationale. You're in your car, right? You've just eaten a banana. You've decided that your car is too good
To keep that
the banana
peel that you
in
just
till
ate
you get
the
to
banana.
the place to dispose of it.
So you can throw
So
it out.
your car is too good for it, but my country isn't.
Yeah. But more people need to stand up and call them out when they do that sort of stuff. And I thought about posting his picture on Facebook.
you
know,
should've.
I have to see if I still have that. It's
Yeah,
you have to
yeah,
shame these people, man.
See, here's what I want to think again. How do you feel? See, the reason you see guys pull on the side of the road and they clean their cars, right? Spick and span. Spick and span. Because why? They want to present an image of themselves. Okay? They want to gal them thing they dread. They got the car. You got it?
See his thing right
You
here.
have the
I can
license
bring
plate
it,
number? Because I'm reading it.
I was going to read. Oh,
Yeah.
shoot. You can't really see it down.
Yeah.
You can't really see it.
Okay.
You can't see it. When I try to blow it up,
No, and it's an old
it's a
plate
silver
too.
Honda something.
Silver Honda. That looked like an Acura or something like that.
Acura's a different.
That isn't that sign? I think so.
See it up
Anyway,
there.
yeah. Boy, anyway, next time to see if we can get.
It's
I
a
mean, I
spike,
know you
like a
tried.
Honda
Yeah,
spike.
yeah, a spike. Okay. So let me just repeat that.
A silver
again,
Honda spike.
Okay. Let me
Nasty.
just repeat that. You feel that your car is too good to keep the banana peel in it until you can get to a garbage
Yeah.
can, but my country, your country, isn't. You want to have an image projected of you with regard to your vehicle that you something, but you don't care about how the image of your country
No.
is presented.
More people should stand up too. When you see people dumping in your area, you should get just as upset. What's your guy's name who was on this show? The Warrior.
Oh yeah,
From Twynham. People
yeah.
like him. I respect because they hate it.
And he doesn't stop.
And he doesn't stop.
And let me tell you, man. Let me tell you. As I drive around this town, and I see the level, and I'm going to be cautious here, but I'm going to throw this out. You see where it's clean, right? Mm-hmm. Mm-hmm. Okay, let's not say nothing. Mm-hmm. We don't need to say anything. Yeah, mm-hmm. See, because if we say something, then it's a problem. So just let's say it this way. You see where it's clean, right? Uh-huh. Okay. You see, and
you see the attitudes of people where it is clean.
You see those? Okay, right. And you see where it's nasty. Mm-hmm. Okay. And then you say, and then those people, the nasty people, have the gall to say something to you when you look down on them. Yeah. Yes, let me just be very clear, because when it comes to litter, I don't hold back, right? I look down on you. Mm-hmm. You stink. You're nasty. You're an idiot. I look down on you.
I agree with all those.
Okay? You're filthy. You're scum.
It's nasty.
Okay? If you feel that you can throw litter around and live around litter, you have zero respect for me. Zero.
Yeah.
And you know why I can say that? Because I don't throw litter around.
Because you know what?
I don't throw litter around.
Oh, okay. All those words were garbled into one.
Okay? And if you're someone I know, and I see you throwing, you shifted into the category of scum and nasty.
Oh, if I know you, I'd call you out, especially. It's disgusting.
Have a pleasant day. We'll be right back. Good evening, ladies and gentlemen. Ed Fields here, along with Rogan Smith and Kendrick, Mr. Versatile Williams. Our guest this afternoon is, we got to fix the mic. Ken's so versatile, he fixed the mic wrong. Dr. Nelson, I'm the one who's versatile. I fixed the mic. Dr. Nelson Clarke, and I have to make a correction. I said, I don't know why, because I said it was Mental Health Month. It's not even a month. It's World Health Day. It's not even mental health. It's a different thing, and it's not even a day. I mean, a week. It's a day. So it's World Health Day, and we're here to talk to my good friend, Mr. Dr. Clarke. How you doing?
I'm great. Fine.
I want to, this is not even related to this subject, but why do we have days?
Well, it's an opportunity to bring focus and attention to a particular issue.
Yeah.
That's basically what the healthcare system does. Okay. They designate certain days so that you can focus. Do some education.
But this is general health now. This is World Health Day.
Believe it or not, the good thing about World Health Day this year is that it has a mental health theme, a mental health focus.
That's where I messed it up.
And it's about depression.
You see, you pretended like I was completely off the wall.
No,
there is a mental health.
No, you're not off the wall. You're not off the wall. You're not off the wall. But this is really great because it focuses on a mental health issue that is extremely common, often undiagnosed. Mm-hmm. People misunderstand it, and people don't see it as a real illness. So this is a really, really important day. April 7th, World Health Day. Let's talk about depression.
Okay. Now, I remember reading an article, doesn't matter, maybe 5, 6, maybe more than that, maybe 10 years ago, about depression. It was a Bahamian article, and in fact, it was a prominent citizen. I won't call his name now, made himself aware, and he made himself also aware that his wife had suffered from depression. And he did all of this, obviously, to make people aware of how serious of a disease this is. And the thing that always stuck in my mind, because subsequent to that, I've had to deal with people who have had depression, is how depression impacts people around the person suffering. It's almost as if you become depressed, you can become depressed yourself.
Well, the truth is, dealing with anybody who is suffering from a depression affects you. And if it's a close relative, somebody who you're in contact with every day, like someone for whom you have some responsibility, you have a close relationship with them, then the impact is even greater. But even on the job, if you got a depressed employee, that person is going to have an effect on all the people around them. And the effect can sometimes be quite worrisome.
Is it just environmental issues that cause depression, or is it something that could be biological as well?
Well, it's both. It's genetic. There's a genetic
Depression is
component.
genetic?
There's a genetic component.
It's a disease.
There's also an environmental component. And then there are stresses that we encounter throughout our lives that may have an impact on us that could push us towards suffering a depressive illness. So it's a combination of factors that come together quite in a particular place, in a particular time, that makes this depression happen in some person.
And I hear,
Go ahead.
no, I was going to say, I hear so many people say, oh, I'm depressed. And sometimes it's lost on me because you just figure that person is in a funk. How do you know if somebody's really depressed, or they just, if you lost your job, you should be in a funk. You know what I mean? But how do I know if you really truly have depression versus you just not yourself?
I say what you would call clinically depressed.
Well, let's take her point, because we have used that word in a very loose fashion.
Right.
And when we talk about depressed, what we probably mean is it's not a good day. I'm unhappy. I had a minor bad experience today.
down.
Someone bumped the car. You know, the cat
You're not
fell
full of joy.
sick. This is a bad day.
Yeah.
Depression is much more than that. There are criteria that tell us when someone is depressed. We actually follow a schema that helps us to be able to make the diagnosis. And so people have to fit that criteria in order for the diagnosis to be made.
Can you present yourself as happy but be depressed?
Of course you can.
Oh, really?
Of course you can. There are people who can smile
Really?
who are still suffering from depression. So it's not just a momentary unhappiness or sadness. It isn't a bad event. It's a real illness.
Is that what they call manic? Give us some stuff.
Different stuff.
Okay,
now.
give us some stuff.
But clinical depression, major depressive episode, major depressive illness, is a real illness, and it you can diagnose it based on the clinical picture that presents. Usually people have to have at least overwhelming sadness or the inability to enjoy the things they normally enjoy, and then 4 other symptoms. Usually there's change in appetite, change in sleep habits, thoughts of death and dying, overwhelming guilt, difficulty making decisions, fatigue and tiredness. Any 4 of those other symptoms must be present in order for us to make the diagnosis, and they must have been consistently present for at least 2 weeks. Every day or almost every day.
And not be depressed?
You can have those and not be depressed, and you know,
But you have to at least have them.
All of us experience it from time to time. 1 or 2 days, no big deal.
Yeah.
But consistent, every day for 2 weeks at least, almost every day, all day.
All day.
Yeah.
Can't function.
Yeah. Difficulty with sleep, appetite, loss of the joy of living, guilt, thoughts of death and dying, difficulty making decisions. Those are some of the prominent symptoms that must be there. And you know, it's a diagnosable and treatable illness. That's the point that we're trying to make. That yes, there are people who go untreated and undiagnosed, but we need to increase people's awareness and sensitivity about it so that more people can get the help they need. Because remember now, there's a real consequence. There's a very real, unfortunate consequence when people are untreated. It's suicide or self-harm.
Or let me ask you: are people who suffer from
harming
depression?
other people too.
Right. That's what I was going to ask. Can it manifest in violence toward other people?
Yeah.
Is that common?
It can happen.
Yeah.
It happens. So we're not talking about a day or 2 of unhappiness.
Right.
This is not just a minor thing. This is serious illness. And of course, there are different times when people are more likely to get the illness.
How do you treat someone who is depressed? I mean, is it with medicine or is it with counseling? What is it?
A combination. Usually, it's a combination, particularly for people who suffer from moderate to severe depression. They do need to have a combination of treatment modalities utilized. Now, when people have very mild depression, you can use certain strategies like exercise and positive thinking and other stuff that helps them. Cognitive behavioral therapy. Yes, even when moderate and severe illness can help, but in very, very severe depression, often medications are absolutely necessary.
I've seen commercials on television, those ones that have the flowery music behind it. Will say if you're depressed, you take this, but then it increases thoughts of suicide. I'm like, Why would I take medication for something
effect,
that
I imagine
the
that's
side
right.
effect seems like it's
Well, let's go back and talk a little bit about why people don't get help, because that's the critical issue. What stops people from
is it the stigma?
from not
still?
getting help? Sometimes it's just ignorance. They don't know what they're suffering from is a depression, because they feel, well, what's the name for this? I've just been feeling this way for such a long time. Nothing seems to help me. Maybe it's just me. Okay? And sometimes people do blame them and say, maybe you should just pull your socks up and get going.
Get it together, man.
Well,
What you got to be sad about?
Yeah, you've got everything.
You got
in
everything.
life.
You got a good
It's
job.
paradoxical.
You got
all
good
the
kids. You got money.
Yeah, it's paradoxical. You got everything, and you're talking about your life's not worthwhile. You're thinking of hurting yourself. If I had what you have, I certainly
Get it
wouldn't be
together,
feeling
man.
that way. Yeah, right. So yeah, and then in our society, maybe one of the things that stops people from getting out is the fact that it's seen as a weakness.
Stigma.
It's seen as a weakness, particularly for fellas like
males.
us. A big, strong, healthy
You
fella
can't-
like you.
Get it together.
How can he possibly
together,
be
man.
depressed? 6'3", he's got everything going for him.
He's very depressed.
Good job and everything. How
I know,
can he
and you know what the cause
possibly
of it
be
is.
depressed?
What?
Over there.
Me?
Okay. See, I've already diagnosed
I've
my
been-
problem.
and we're
Resolved my
sitting here-
problem.
We're sitting here
No
talking
medicine.
about it and laughing about it.
But it's not funny.
And it's such a serious
I want to
illness.
ask you, Nelson. You'd think in this day and age that people would have enough information to know when this is evident. But I imagine there are tons of folks who, like you say, just think, "Oh, I'm just not feeling good, and I'm always not feeling this way." How do people? Because I imagine the person who's afflicted might be the one who's least aware of what's impacting them. But how do people around them? Because I know, having been around someone who suffered from depression, that the anxiety that's caused in folks around is severe. It changes the whole dynamic of an environment. How do those people get trained to say that person may need some help?
Okay, part of the challenge is knowing enough and being prepared to make the effort to speak to the person in terms that they understand, that tells them that you care. You're not trying to hurt them by putting a terrible label on them, but also being prepared to go beyond just talking to them, but being prepared to assist them in making whatever the contact is that needs to be made for them to get out. So take them to the clinic or take them to their GP. Being
Supportive.
prepared to do something practical to help. Because after you've talked and the person says, okay, maybe I'm not myself, or maybe I don't understand what's happening, then the next step is, what do we do? And if you leave it to the person to do it on their own, it may not happen.
Right.
If you leave it to the person and say, you go see the doctor, go get help, man. You just need to pull yourself together. Go see the doctor. They're not going to do it.
Yeah,
so you may have to say, let's make the
An
appointment,
intervention.
and I will go with you. And then you may have to be part of the process. You may have to be able to tell whoever is doing the evaluation what you've seen, what you've observed, what the person was like when they were well. Now what the person is like now that they're having this illness. And so you have to be supportive beyond words. You have to be supportive in action as well.
Can someone? Well, so first of all, if it's genetic, that means you can be
And it
born.
doesn't stop there, because now when the person is getting help, the follow-up is important, and making sure that they
So
do
it's
the
a big
things
commitment.
that they've agreed to.
So when someone is genetically is predisposed to depression, when does this manifest? And from your experience, how long can someone who suffers from this go on undiagnosed?
Well, it can be years. People can have depression on and off for years, and not ever have it diagnosed. And I'll tell you why. Because sometimes people do things that may camouflage the symptoms, or maybe sometimes people self-treat. They do things to help themselves get better, or maybe a little alcohol, you take the edge off. Maybe some other drugs may help. Maybe some other types of behaviors may soothe them and help them feel okay. It doesn't really get to the core of the problem, but it may be a temporary thing.
So you find that people who are, for instance, drug addicts or who may suffer from alcoholism or one of the things you see, sex addiction, all of these things, they could be
Those may be signals. Those may be signals that the person is suffering from a depressive illness. For instance, let me just talk about the gender differences, because the gender differences are stark. Women go to doctors pretty regularly, and last year I had a checkup.
Oh, don't worry about me. I'm I'm semi-hypochondriac. Don't worry
Well,
about me.
most of
guys,
us,
they
guys, they're clear
is true.
doctors.
That is true.
But if
Which I don't understand. I don't understand that, but that's another story.
Okay, and for most guys, the word depressed is not one that they're very comfortable using. It's not part of their vocabulary. They will not talk about themselves in those terms. They may say some other things. I'm fed up, angry,
Depressed.
bust somebody, but they're not going to say,
Why do they view it as them being soft?
It's a weakness. So it's unmasculine.
You alluded to the fact when Rogan.
No, with the women. He was talking
sorry,
about,
sorry.
he was, the women.
Women, on the other hand, will see their doctor, are very, very able to talk in psychological terms about inner feelings and their well-being or distress. We're not. We're not socialized like that. And so a woman, it may be a lot easier for her general practitioner to pick up on the fact that she's depressed. Because she's coming to him, and he's seeing her when she's really well, when she comes for a general check.
Treatment, etc.
More women access care, more women get treatment. Okay, they do a lot better with psychological issues sometimes than we do.
Yeah, I agree.
Okay, so for the man, this may be a big issue for us, huh? And this is why the suicide rates for men is so much higher than for women.
Rogan had alluded to in the beginning about what is causing she talked about environmental. We got to take a break. When I come back, I want to ask you the correlation between what our environment is in this country and the level of violence we see. Is that a manifestation of depression? And is that depression more environmentally caused than genetically caused? We'll be right back. I got a new director here, man. You wasted time. You wasted time, Doc.
I listened to you while you were on the previous show. Yes, I heard that.
You heard the versatility? All right, no problem. Listen, well, there are two questions, but I'm going to follow up with what we left off with, and that is Rogan had alluded to the fact that, or queried as to whether this is biological or genetic or environmental, and you said it could be both. We have obviously, and the fact that depression leads to other manifestations. We have in this country a very large violent, response to things. I may be overstating it, but it seems that we respond violently to a lot of things. Is that in part due to an environment that nurtures depression?
Let's answer your question in two ways. Yes, there is hostility, anger, and violence in our society. And the causes, there are many causes for it. One of those causes may be something that is fairly obvious, the terrible overcrowding that we have in certain areas. Poverty may be the other associated factor. Those two play pretty high. And then we have modeling. We have once you see violence, once you accept that violence is a way to deal with stuff, then you become a convertee. You're somebody who's going to do it too.
Okay.
And when there are no consequences quickly to address violent behavior, when it doesn't get dealt with immediately, when there's a delay in the consequences, then that tends to reinforce it too. So if you do stuff and there's no consequence, the likelihood is you will continue to do it. And if your children see you doing violent stuff, then they're going to do it too. Now, when people are depressed and they feel hopeless, then sometimes they too can act out their anger in a particular way that means that other people get hurt, or sometimes they hurt themselves. Sometimes the anger is turned inward on themselves, or it's outward on the people who are closest to them.
But if you were to do an analysis and you looked at socioeconomic factors, is there a correlation, disproportionate correlation between poverty, lower socioeconomic lot in life, to say wealth? I mean, I know clinically it won't matter, but environmentally, does it matter?
Environmentally, it may matter because if you've got severe overcrowding, if you've got impoverishment, poverty is one thing, but when you have no opportunity,
hopelessness, as you say,
you get no opportunity, then that creates another scenario, another reality that says, well, nobody cares about me. Why should I care about other people?
Okay.
Nothing's been done for me. Why should I be part of this game? Why should I play by the rules?
Do you see a lot of seasonal depression where folks, like, let's just say, for example, around the holiday time, they get into this deep depression? So it might not be something that manifests year round, but just particularly during holiday season where people are generally happy.
Like Christmas.
Yeah.
Well, you see some of that, but the truth is it's not quite seasonal. It may be kind of like anniversary or associated with the holidays, but it's linked to the fact that maybe at this time of the year, I used to have this person with me, or this person was part of my life. They're no longer here. I miss them. Right. Or maybe there was a tragedy that happened last year or the year before around this kind of time, and I relived that.
Yeah.
And so you're going to see the person go through, maybe a week or two of depression. It may not last the way clinical depression usually lasts, but it may mean that every year that anniversary, or every year that particular holiday, they may experience this phenomena.
But what if it's not linked to loss? What if it's just you?
Trauma of any kind. It doesn't have to be. When you say loss, what do you mean?
I mean, like the loss of someone who either died or who just walked out of your life. What if it's just you're seeing people in a happy state, but those external things don't make you happy in that moment, if that makes sense?
It does make sense. And if you're already depressed and you notice other people having a great time, then that reinforces the significance of your particular depressed mood. Yeah, what have they got to be so happy about?
Yeah.
Why? Yeah. How can they be enjoying themselves and I'm miserable?
Yeah. Joy to the world ain't for me. Listen, one of the things we were talking about off mic is the fact that when it comes to mental illness, and I mean that because, it's amazing how when we were growing up, you and I, not me, maybe not so much, how we just kind of classified everything like he crazy and this, you just clumped everything together. And we didn't see mental illness as illness or disease. We saw it as something wrong with that person. Tell me how we correct that, number one. And number two, what is a person feeling? How do we learn how to empathize? See, if someone broke their leg or got run over by a car, you can empathize with that. Boy, that must be hate, eh?
Yeah.
But when someone is feeling some degree of mental illness or some kind of thing, we don't go like, boy, I could feel how they, you don't feel that. You don't empathize.
Those are two really good questions, and I'm going to try and answer them as best I can. The first one, what do we do to change people's, attitude and knowledge?
Empathy, yeah.
And then get them to be able to empathize. Yeah. So it starts with education. And the same way we educate people about all the other stuff in the world, we got to use the same system, the educational system. So somewhere along the way in schools, they're educating about all kinds of stuff now. We could include some emotional stuff in there. We could say these are things that happen to some people, and everybody is at risk because everybody is at risk for depression. Even though we talk about genetic influences and environmental influences, the truth is anybody can suffer from depressive illness. In fact, 1 in 5 people in their lifetime may be at risk for depressive illness. 1 in 5 people. So okay.
It's only 4 and yes, so no one doesn't count.
I think I may be in that.
Yeah. Okay. But I know, of course, I can solve it.
So that's an important thing, right? So part of the thing is educating people from young and confronting some of the myths, because we have a lot of myths about what causes it, whether or not it can be treated, who can get it, and what people are like who get it. We have some misconceptions about what people look like who get it, what kind of families get certain things. There's a whole ton of myths about this area, and we have to do a lot of work to dispel them. And the people at Silence, the people who work in mental health, the people who work in medicine generally, have been trying with it, but it has to be consistent and prolonged. and it has to go on. And we have to start fairly early.
Yeah, because unlike a lot of things, like say, look at cancer, for instance. I use that as an example. So many people have been impacted by cancer that there is a lot of education, a lot of awareness, because almost every single family has had some impact by cancer. So there's an innate empathy and awareness. But in this instance, you may actually have people who are impacted and you don't even know.
So let's go to the second question you had. You said that there are people who, if you get a fracture, you get a traffic accident, you have a fracture, intuitively know it's painful. Blood, broken bones, we know it's going to hurt. But when people get depressed, when people have a depressive disorder, depressive illness, there's something that stops us from being able to connect with them, to say, okay, that could be me. That must feel terrible. All right? Maybe the education has to take into consideration that too. And we have to kind of make it clear what's going on with people who are depressed. Yes, they do feel terrible. And one of the bad things that happens is they actually do feel that nobody understands how they feel. That even though you may say stuff that sounds kind of right, deep down inside they figure you don't know. You have no clue.
You suffer in silence.
Yeah. And so this is one of the good things about group therapy. When they sit with other people who've had the disorder, they sit with other people who felt it, they become part of a little group now who can share those feelings and have the feeling or have the awareness that the other person sitting next to them really understands, because something they say about how they've been feeling or what happened to them connects with this other person's experience.
How do they feel?
You've been in that with them, and in their terms, life is no longer worth living. Maybe one of the things that they actually speak about. That tomorrow, when I get up tomorrow morning, it's going to be another horrible day. I don't want to get out of bed. I want to cancel the day.
What are they saying, Doc? What are they saying?
They're saying that
not saying, seeing. What are they? I mean, I'm trying to really get that feeling. What is this? I mean, I try to think of, like, say, someone who's in prison, right? And I can empathize with someone who's in prison to the extent that I can't imagine being locked up.
Have you been unhappy?
I've been unhappy.
Have you had anything really bad happen to you?
I guess in the grand scheme of things,
anything?
Not
of value?
I mean, yeah, I assume so. It seems minimal. It seems like it's trite compared to what you're saying.
And you get over it eventually. The next day. Multiply that feeling by 10, if you can, and maybe you're approximating the kind of feeling that the persons who have severe depression may feel.
All the time,
consistently, from the time they wake in the morning until they go to sleep at night. For 2 weeks or more.
Did you feel that? Did you feel that again? It just finally kind of hit me.
Yeah.
That when you feel like, the feeling like if you just lose your phone for a minute, you've misplaced it. Just misplaced it. And then, you get relief when you find it, right? So like some guy told me, I saw a comedian once who told me, the feeling you get when you lean on your chair and you catch yourself when you fall back. He said, I always feel that way. Imagine always feeling that sense of panic.
Yeah. Well, imagine that feeling that you get when you've had a moment of unhappiness. Multiply that by 10.
By 10.
And then think about it happening every day from the minute you wake up until you go to sleep at night. And maybe some nights you can't get to sleep.
Right.
And maybe some mornings you wake up too early, because waking up early is one of the symptoms. People get up at 3 o'clock, and what's on their mind? How bad they feel.
What?
So the minute they wake up in the morning, nothing works. They lose interest in all the enjoyable things. And think about, this loss of the ability to enjoy anything. Nothing, even food that used to be good, tastes like cardboard.
I like that you dispelled the myth earlier. You were myth busting, because a lot of times, I know you say how people feel, but I always concerned myself with how they looked, and so I always expected the long face, the sallow expression, not thinking that someone could be smiling in my face, but just going through the worst moment, inside. And
some people look very capable of putting on
the happy face
for a couple of minutes. The pretense.
It's a survival mechanism?
Well, it's more than that. It sometimes is necessary because other than that, you're gonna get the what's wrong with you,
Oh.
why you're so sad,
Yeah,
and that adds
yeah,
to
yeah,
the
yeah.
depression. That
Yeah,
adds to your
yeah.
feelings of hopelessness and unhappiness. The fact that they can actually see that I'm unhappy, God, it must be really bad.
Mm.
You know, so some people master the art of a little pretense. You know, I mean, you've
And
had
that's
some notable.
it's almost self-preservative to
but
do
you've
that.
had some notable people who've done that. In fact, some of them were comedians, right?
Like Robin,
Tears of a Clown.
Robin, what's his name? Williams.
Yeah. He killed himself.
Yeah. So
Yeah.
it can happen. People can
And you
present
look
that
at a guy
as,
like that and you go, how much more accomplished could you be?
What would he need to do that for? Why would he do that? He had everything going for him.
Mm-hmm.
You know. So it's paradoxical. It doesn't make sense. The logistics, the logic of it, can't understand it.
You talked about some of the symptoms. Are hallucinations possible when you're suffering from depression?
Yes. Yes.
Is
And
that
in
really?
some kinds of depression, people can have.
Well, what kind of hallucinations are you talking about?
They could hear people making derogatory statements about them. They
paranoia.
They can no just a hallucination, a voice that's condemnatory, which is part of the syndrome. I'm a bad person.
Yeah.
I'm no good. I'm a failure. And so the hallucinations will take on that same tenor.
I tell you what, you have probably, and I've been doing this for a long time, and we've had folks on, and you've probably illuminated this more than I've ever felt. And I hope, one of the things, and we repeat it every week, I hope one of the things we do is if there's one or two people, Nelson, who are driving and they recognize the possibility, it doesn't mean you have it, the possibility that if they do, that they can get help. That's what this show is about, and that's what you're doing. World Health Day is to get people, to make people aware.
That's the idea.
So the first question I ask you, why? This is why.
Yeah, that's the idea. And I think there are people who will listen and who will connect with what's being said, and then they want to know, well, what do I do now?
What do we have? Now, I want to ask about the Bahamas.
Can I ask this one question before you go there? Is the treatment the same for children?
No, children are different. Children are part of a system called the family, the parents. And so often when children have depression, you have to pay attention to everything going on in that system, including the parents and the siblings. But yes, sometimes children do need to have some of the same interventions that adults and adolescents may need. But we tend to try not to give children medication.
Yes, it couldn't be long term.
We try not to. That's really important. But yes, children can suffer from severe depression as well.
How equipped are we locally? When I say locally, obviously the Bahamas. How equipped are we locally in terms of professionals, in terms of facilities, and opportunities to deal with this?
Let's go back a little bit and talk about what's happened in the world and what World Health Association World Health Organization has been trying to do. The World Health Organization recognized about maybe 10, 15 years ago that there was a gap between needs and actual treatment. Who needed it and who would get it. And in this part of the world, in the Caribbean and this part of the world, the gap is probably about 55-56% in terms of people who need services.
And can't get them?
People who can't get it, who don't get it. And that may sound simplistic in some ways because you really have to look at why people don't get it, and we spoke about it earlier. Sometimes it's ignorance, sometimes it's
they haven't
stigma.
presented themselves for treatment.
But sometimes the other factors, maybe then there's nobody available to treat them. So what the World Health Organization did was they looked at how you could shore up and make available treatment for people who need it in what they call low and middle income countries in this part of the world. And they came up with a plan called the Mental Health Gap Program, which meant that non-specialists would be trained in how to diagnose and treat these common mental health problems like depression, alcohol dependence, and anxiety, and so forth and so on, like 9 particular specific areas. And we've done it here in the Bahamas, and the people who work in family medicine and general practice in the public system have had training in how to diagnose and how to treat and when to refer for specialist services. So some things have happened that means that people can get care, can get treatment for these disorders in the public public care system.
What is our equivalent of in the States? You have the Hippocratic Oath.
The same
It's the
thing.
same thing here?
Yeah.
So, okay, so there are repercussions for doctors who reveal your personal information if you go and if you sit down for counseling
Absolutely. Even if you don't sit down for counseling, whatever you go for, they can't divulge your information.
And I'll tell you,
unless you sign a waiver.
Yeah, and I'll tell you, when you think about
that's my fear.
I think when I look around though, when I see how many people probably who presented themselves for counseling, etc., you don't hear a lot of stuff in the general domain, the public domain, about people who got treatment and what their issues are.
I'm glad you said that, because I think that helps a lot of people to understand that the confidentiality is a good thing.
Yeah, I don't generally hear in the workplace that the person went to a counseling and this is what the doctors say wrong with them.
I've actually heard instances where doctors have revealed certain information about people, and that scares
in the mental health side.
Oh, absolutely. And that scares the crap out of me.
In mental health?
Yeah,
I've not heard it.
Yeah.
Well, anyway, we're gonna take a break. We'll be right back. Yeah. Good evening, ladies and gentlemen. Ed Fields here, along with Rogan Smith, Kendrick Williams. Our guest is Dr. Nelson Clarke. Nelson, we're here talking about World Health Day, which has the theme or the focus is on depression. I want to ask you a question that may be odd, but I'm going to ask it anyway. People like yourself, and I think of people like this, like people who are in the profession that you're in, people who are in social health, who see and feel this pain that others, I'm assuming you feel it, but see the pain that others in our society are feeling. And it's really widespread, okay? Especially when I think about social workers and the kind of scenarios they must see on a daily basis with the families and fellow human beings. How does that impact those of you in the profession? I mean, I just feel compelled to ask that question.
That's a good question, and I guess it probably is much the same for people like you. You have your fingers on the underbelly of the society. You're involved in news. I mean, you must get a lot of stuff firsthand. You must hear it before the rest of us even get a whiff of what's going on.
But it's very superficial.
And sometimes it's very close to home. Sometimes it impacts you too. We all have feelings, and we're not immune to being affected by what we hear every day. Maybe through the training, we have developed some skills in how to manage those feelings. Maybe we have to pay particular attention to our own health and our own particular struggles that we have, because we all have struggles. But no, we're not immune. We're not immune to being affected by the suffering that we see or that we come into contact with every day. I think maybe that's one of the reasons that keeps us doing what we do, because we want to help people get over, get beyond the pain that they're feeling. And so it's a good question. And I think we all have to have our coping mechanisms, our coping strategies in place to help us deal with what we encounter every day. And sometimes it does affect people, and people need to take a break. It does affect people, and they themselves may need services provided by their peers. We're not dealing with automatons and people who have no feelings. We're dealing with real human beings.
In the world of medicine, and I think we need to now start recognizing that mental health is in the world of medicine. There are, specialties that deal with various range of things. So, for instance, oncology deals with a large degree of terminal illness. Okay, in the HIV in the HIV world, we see where people have gone. I know a lady named Sister Claire, and she has gone from where she saw everyone dying, she knew they would die, to where we have got to the point where no one dies. It's a treatable disease. Well, very rare. Very rare.
Very much less.
It certainly, there's hope.
There's big progress.
Right.
Yeah.
What do you see in the mental health world as far as making progress? You started out many years ago. You tell me you're old. I don't believe that. You started out many years ago, and what you have seen then, 30 years ago, maybe 35 years ago, to now, have you seen progress?
Absolutely. There's been quite a lot of progress. Let's look at it from several different perspectives. We now have so many modalities that we can use, very effective treatments to help people who suffer from mental health problems. The knowledge base has increased tremendously. We now understand a lot more about what happens and why it happens, and we also have a better understanding on even how to prevent some things from happening.
Oh, yeah?
Prevent some disorders from happening. Yeah,
I.e.?
we talk about that in a little bit.
Okay. Well, we don't have a lot of time.
We
got time.
Yeah,
We get it.
yeah. And the good thing is that, years ago people had to be in institutions. We know that people can live full lives out in the community who've had mental health problems, and in many instances, you would be hard pressed to tell that they've had a mental health problem.
Have you seen the use of asylums decrease over the years globally?
Yes, absolutely.
Because people just took them and throw them away.
Well, because the methods of treatment are so much more effective.
The pharmacology, all that stuff.
Yeah. So there's a lot that's happened that's created hope, and maybe more progress will mean that we get even better results.
This is good news.
Now, when it comes to prevention, one of the things we understand is that the health of parents absolutely affect the health of their children. Environments, even though we know environments are only part of the situation in regard to developing illnesses, environments like the home and like parenting, what you see, what you hear, what you experience, can have dramatic effect on how you see the world and how you feel about yourself, because those factors can help make you more resilient and less likely to get certain disorders, certain problems, certain behaviors that you can encourage in children will help them to be less likely to get certain disorders. So self-esteem issues, for instance, will mean that they're much less likely to get involved in certain things and therefore become,
but
ill
society,
with a particular disorder.
But
for
that's,
instance, let's say substance abuse.
Yeah. But self-esteem is an interesting one that you bring up, because it
Yes.
seems to me that there's more pressure on the generations today. And I hate it sounds so, parental, but the generations today, it seems that there's more pressure on them with regard to self-esteem issues.
Well, there is, but there's also a need to help people manage that a little bit better. I mean, people got to accept that there's sometimes you succeed and sometimes you fail. Doesn't mean that you're worthless if you fail at a particular thing. Yes, some people have extra talents in certain area and you don't. Doesn't mean that because somebody's better than you at something else,
that you're a failure.
Yeah, and that's one of the things that happens, because we're in such a competitive environment sometimes that kids begin to get negative about themselves if they don't beat everybody, if they're not as good as the next person. You have to teach people that it's okay if you're not the number one person in a particular sport.
I don't know if you, I know that medical professionals always have to continue to educate themselves. So I don't know, because you say you're a senior citizen
I still have to do my CME.
Okay.
My continuing medical education.
So I don't know if the most recent continuing education course you took dealt anything to do with this.
Yeah.
The impact of this.
Yeah.
Ladies and gentlemen, I'm pointing to the phone.
This is gonna sound really interesting for you. I mean, the jargon has changed a little bit in terms of addictions, huh? And nowadays we're talking about these electronic device and the addictive potential of them. Huh? There are people who will panic if they leave home and they realize they've left their phone.
Gotta turn around.
Oh yeah.
No matter how far away they
Just
are, they
did
gotta
that.
go back. All right. And if they come into a meeting and they put the phone in front of them, they don't turn it off. And if it blinks one and says that there's an email for you, they have to pick it up immediately and check it out. And if you distract them so they can't do it, they get a little anxious, a little irritated.
Irritable? Irritable? Okay, we can over that. We diagnosing a lot of stuff in here today.
Yeah.
Okay.
So it's having a dramatic effect, and of course now we expect instant results and instant.
This is the one. This is the one.
If we send an email to you at 5:01, we really do expect you to answer by
5:02 at least.
5:05.
Yeah, that's
At
me.
least 5:05.
If you
That's
don't
my
answer,
expectation.
you don't want to answer, something's seriously wrong. We got to get on do something about it right away.
The one that really panics me when I think about it in terms of my child and others is this phenomena of like. That when I send something out, I gauge my worth
Yes, based on
by
the
how many
likes.
people respond. If no one responds, I feel depressed.
Yes. Of course, this is a new thing. I mean, every new device that comes out, you must get it, right?
Oh, I know people like that.
Every new upgrade that comes out, you
Yeah,
must have
I
it,
appreciate
or
that.
or you're not with it.
Yeah.
You
say
can't
that.
stand that boy.
You're too calm for me,
I
man.
can't stand that.
You're not with it.
Yeah, you're not with it. What's
Yeah.
wrong with you? Don't you have 2.3 or 2.31
Yeah.
or 6.0?
Yeah.
When are you going to get it? You know, people.
When are you,
Yeah.
when are you going to get it?
Yeah, but it's distortion.
It's a fait accompli, right?
Yeah.
It's not.
It's not.
what's
Are you
funny-
going to get it?
Yeah.
When are you going to
when
get
are you going to get with it?
Yeah.
Yeah,
So
yeah.
it's changing. It's changing the way we interact with each other. People go to dinner and rather than talking to each other,
Oh, I
they're texting somebody.
Oh yeah,
else.
we get into the nitty gritty now.
You go to dinner with 10 people, and everybody's
Everyone
sitting
is-
around the table, and 3 or 4 of them are talking to each other using
They,
the
yeah,
device.
They talk to each
they have
other
nothing
with
to
the device.
say,
Yeah.
but in the group, but they've got a commentary going on what was said at the dinner with somebody else
So
in the dinner.
it's layered,
And
layered conversations.
It's sad, eh? Because it means
Sad.
that the human interaction is now gone from being verbal to being this other thing. And
Well, as I
it
often
isolates people.
I said it's amazing how the advent or the introduction of this device has authorized rudeness.
There's one more. You've got something on your ears right now.
Yeah.
And I just walked down the hospital 3 days ago
Right.
and saw a phenomenon where there were 2 people coming towards each other and both had
The headphones on.
headphones on.
Yeah. They ain't interested in communicating.
And one did this to the next one, and the other one didn't see him.
Because he couldn't say hi.
Totally
didn't.
didn't.
Yeah.
You know what I mean?
yeah.
So how does that impact human interaction? How does that help people to feel connected? Yes, you
The
probably.
whole sense of community, everything starts to lose itself.
Well, it's different. It
It's-
doesn't lose itself. They have a community on that.
It's like
that's true.
but it's like
That is
collective.
true.
It's like collective hermitage.
yeah.
You
But
know?
they've got a community there because they would.
Yeah.
I tweeted so and so.
So yeah. The fact that he's in Iceland, okay, good. And the fact that you may never even contact that person, but that makes you feel good. Could it be? Let me ask you this, and Rogan probably would agree with this. On the negative side, we talk about how it's distracted us, but on the positive side, could it have connected people who may not have been connected?
I mean, tell you. I mean, are you a gamer? Do you play games?
No, I don't play
You
games.
You don't play
No,
games.
no.
Well, there are people who play. People 4,000 miles who never see them, but who have a friendship with them. That's phenomenal, right?
Yeah. So, but
And they will make a date to play on Friday nights for 2
Yeah.
hours
Uh-huh.
this week, and then next week they'll play, and they'll invite somebody else to come to the game,
Yeah.
and they'll play with them.
Yeah.
And that's a different kind of friendship, right? They've never met each other,
Yeah.
but they've shared pictures.
Yeah. And we don't even know it's a real picture.
You don't know.
Catfish.
Yeah.
What's that? Catfish? What is
Yeah.
catfish?
Like when you lie about who you are online, or to lure somebody in. Yeah, and that's not who you are.
Okay.
You never heard of that?
No.
There's a whole program on MTV or VH1 about it.
I'm not with it, Doc.
How much more time do we have? Because
You
I think
We're out of time. But
maybe
you
out
can
of time,
go
but
ahead.
Go
one
ahead.
of the things we wanted to do was to maybe think about people who have to live with somebody who's suffering from a depressive illness, because that could be particularly difficult.
Right.
And sometimes that person becomes so overwhelmed that they need some support.
Okay.
They need some help.
Right.
And they have to be prepared to reach out and look for that too, from people around them and from various structures in the society, their church, other members of their family, and so forth, because it can become quite overwhelming. I think you alluded to earlier how overwhelming it could be from people who are close within the circle to someone who's experiencing depressive illness.
I witnessed it firsthand. Listen, Doc, we've got to go. But to be continued.
Yes.
Definitely.
Need to let
Okay,
me
to
know
be
when you're ready.
continued. Roganna's going to get in touch with you, and we'll have you on again, and hopefully you'll bring some folks with you. We can talk about this more. It's important. It's important stuff, because what we're doing is not just doing this for entertainment.
No.
We're doing it for people who maybe not understanding what's going on with them, and this may help them to understand. And that's all we can hope to accomplish.
Thank you for inviting me.
Thank you for coming.
Great hour.
All right.